Good catch.
Okay. All right. Let's see. Okay.
Join the meeting.
Okay.
All right, cool. Thank you. Happy New Year again, everybody. I'm Courtney from PATH. We are People Assisting the Homeless. And we are here to give an update on our previous work from the last meeting. So November and December. So Haley is a little late. She'll be joining us at 3:30. She might miss out on this one, which is, it's okay. And Anna is here as well. She's a bit congested, so I'll be presenting for the most part. So this is our team. We did lose a staff member toward the end of November. The good news is we did have someone start yesterday, new to the team. She's not on the pictures, but her name is Jennifer. Here on these pictures, we have Anna, Jillian, and Stephanie. We're still in the streets providing intensive street-based case management, assisting with providing permanent housing and interim housing referrals, as well as helping folks fill out those voucher interest forms and applications for the vouchers as they get matched. Next slide, please. So we have Jillian and Stephanie out here really dividing and conquering. This is their outreach schedule. Since we have Jennifer on board, she'll be shadowing them to get familiar with Spot 8 and the cities and the areas that we cover. And so what we've done with the team is they go do joint outreaches, so they won't necessarily be alone on the streets canvassing. So we do joint outreach with like LASA and Harbor Interfaith, Mental Health America, and those are scheduled mostly through Harbor Interfaith. Next slide, please. And of course, yes, continue to submit your LA HOP request. This is the best way to get the proper team out to the to the participant that you want to have engaged into services. So put as much information as you can, the best physical description you can, and even if possible, get that person's contact information so we can call them and locate them as well. Next slide, please. Since November, in the months of November and December, we received 19 LA HOP requests, and here's the city breakdown. So definitely continue using LA HOP to get an outreach team deployed to members in the community. Next slide, please. So as I said earlier, we are out here in the community doing joint outreach. There are some specific areas that we do our joint outreaches. We're also at the Redondo Mill program, St. Andrew, James, First United, on over at Shared Bread, as well as some of the local police departments, reach out to us, if they have questions or want us to go engage someone. And then we're also working with Doors of Hope and Beacon Light Shelter, as well as some of as the Bridge Homes as well. Next slide, please. Community referrals. So we do have a pastor in Hawthorne who will send me directly referrals for people that are in need. He basically wanted to just send them to me, and then we kind of do problem solving or kind of refer out. Not everybody that he refers us to, we're able to work with their families, and so we have to refer them to the family system. But he so far has referred about 15 individuals to us. He has a food pantry at his church, and so if he encounters folks, he'll just give them my number, or he'll call me with that person on the phone, and we kind of go from there to point them in the right direction. As well as some of the city, the cities, Gardena, El Segundo, and Torrance folks will reach out to us as well, to either work with their outreach teams with folks, or if we're already case managing, someone that their outreach team is just collaborating and getting that up-to-date information on that individual. Next slide, please. So our outcomes so far, this time we did percentages. It doesn't really matter. But of the folks that we're case managing right now, we've connected 8% to permanent housing over in Supervisorial District 4 and 15% in Supervisorial District 2. And of course, we're still connecting people to mental health resources, primary care, substance dependency, and assisting people with increase in their income, whether that be GR, employment, or connecting people to CBEST to see about obtaining or seeing if they qualify for Social Security benefits. Next slide, please. So since September, that's when our contract starts. We've enrolled 12 new people. We're currently case managing 52 people. So Jillian and Stephanie have a little over 25 folks on their caseload. 18 folks are seniors, and we've referred 8 people to rapid rehousing, recovery rehousing. You have to get matched to that through LASA. Sometimes we can kind of advocate to get someone in, but most of the time it is through a match through LASA. And then connecting people to the tiny home villages and pallet shelters. So that's the one in Redondo Beach or the tiny, the Salvation Village over in Harbor City. We have submitted 49 vouchers for folks. Pretty much everyone who comes on our caseload, we will submit the interest form. So far, we've gotten 18 vouchers matched, which means we get the big application from the Housing Authority that we have to fill out and turn that back in. And then of that, we've gotten 2 voucher issuances from those. Next slide, please. And then Anna will talk about these success stories.
So this is Heidi. She was recently housed with the assistance of PATH as well as Mental Health America. She was able to get enrolled into the PATH villas over at Southgate. She did say that she was extremely thankful and overwhelmed that she has finally been housed after living in her car and just finding a spot to park at where she won't get her car towed away. She did mention on the picture, as you can see, she's holding a little black little item. It is her new fancy key that she calls it, out of this world. So she was extremely happy and joyful to share that with everyone. Next slide. We've also had another individual by the name of Tanya. Unfortunately, she declined for a picture, but she was more than glad to share her story. She had been homeless for about 2 years before the PATH outreach team encountered her at the Redondo Beach Homeless Court, or through the Redondo Beach Homeless Court. With full-time employment, even with full-time employment, she wasn't able to obtain permanent housing. However, PATH was able to connect her with also rapid rehousing through PATH. And now she is finally stabled and has found a unit that fits her her situation, and she is extremely grateful as well. Next slide. Teamwork makes the dream work. We have, like mentioned before, continued our joint outreaches. This is one of them in Lawndale and Inglewood with CityNet from Redondo Beach. Next slide. Future considerations, again, more promotion of LA Hop to our community members, staff members, anyone that you encounter. We did see a slight decline in numbers of requests through LA Hub. I don't know if it's because of the season or the holidays or whatnot, but we did see a slight decline in the requests that we did receive for the past 2 months. So we want to encourage everyone to, if you're not familiar with it, explore the site, or also just recommend it to anyone you meet. Next slide. These are our contact information for Courtney and myself. Feel free to reach out whenever you need any assistance or you have any comment, questions, or concerns. Next slide. Thank you.
Thank you guys for that. Does anybody have any questions for Pat, for Courtney or Anna? Go ahead, George.
Thank you, Courtney. My question is with respect to Courtney's segment of the slides. I believe there was one, Courtney, where you show some statistics on, how many people have been housed by a certain way. I was wondering if we can flip to that chart quickly, whoever's controlling the slides. That one. I'm trying to understand this a little bit better, Courtney, because usually,
Sorry.
usually when I see charts with percentages, somehow in my mind, when I add all the percentages, maybe they all should equal to 100%. And in my head, there's certain percentages missing, or did I just not misinterpret, or did I misinterpret how to really read the information here?
I can kind of explain this chart. This is based off like the caseloads that we have. And we have a total of caseloads of 52. So 8% of our caseloads from the District 4, Supervisory District 4 were housed. 8% of those individuals received increased income assistance or were able to increase the income. And it's the same situation with Supervisory District 2. 15% of our caseloads from that area were able to get permanently housed.
8%. Okay, so on the lower part, if I just look at Supervisor District 4 or Supervisor District 2, 8% and 15% of the caseloads.
Yes, from those areas. Yes, correct.
Do you happen to have a rough number? What is the number of the caseloads?
We have a total of 52 from both areas. From District 4, Supervisory District 4, I believe it is around about 38. And Supervisory District 2 is, I want to say 14.
Okay, at least for me, because it's kind of hard to tell by percentage how many folks that really got the help. That's why I was trying to, yeah.
I see.
Maybe that's, if
Sorry
it's just
for the
easy to put the
confusion.
number of heads on there, that gives a better appreciation, at least just for me. At least.
Right.
Yeah, we'll do that next time. We were just
Yeah.
trying something different.
Yeah, I tried to tell how many people got help with 8%, as opposed to like 8 people. Thank you.
No
Thank
problem.
you.
Any other questions?
Zen?
Yeah, thank you, Ronson. Question, when you're saying supervisory districts, are these the old districts or the new districts?
The old districts. I just learned yesterday that there's been some districting. So
Right.
on the next, and I don't have that updated map, but on the next one, hopefully
Okay,
we'll have it.
and don't worry, LA County doesn't have that updated map. I just Googled it. And
Okay.
they're still showing the old map. So, all right. Another question I had is when we initially had this pallet shelter set up in Redondo Beach, in my district, a while back, we had a lot of people going in and a lot of people going out. And now it seems like there's been stagnation where there's nobody new being added to it. And I'm wondering what's the issue? Where's, I guess, the log jam in the system, if there is a log jam?
Harbor Interfaith, Max could probably better answer that. They run that pallet shelter in Redondo. I know we have people on the wait list, but I think right now, just as a bigger picture systems issue is like finding the permanent housing. That's on our end, as working in permanent housing programs as well. Getting the actual units, the permanent housing has become kind of where, from our experience, is the bottleneck.
Got it. Is there anything that we can do at the municipal level to help with that?
Have some affordable housing in Redondo.
Oh yeah, we're working on an inclusionary housing ordinance, but
that is literally the answer for all the cities. We need affordable housing in your cities.
and what's the wait list look like to get into the pallet shelter?
Max or someone from Harbor Interfaith could probably better answer that question because they run.
Yeah, I can cover all of that, and I'll talk about it in my report.
Oh, got it. Okay, cool. Thanks. And Sherry, if you could also send me your contact info, because I was actually looking for it and I could not find it. Please.
Not a problem.
Thank you. That's it.
Okay, anybody else for Pat?
I had a quick question, Anna. I noticed on the LA Hop responses, El Segundo had 5, and that was kind of like the most of all the cities. Do you see anything changing on the ground, or is that you think that's maybe just like a one-time anomaly, or maybe that's just one person with multiple LA Hop requests?
It's mainly coming from the PD department. We made direct contact with them. Sometimes they do call us or text us or email us direct contact for someone. But if that person doesn't have like a phone number or isn't in the same location a lot of the times, they make an LA Hub request and tell us the surrounding areas that they are located at. And so that's why there was an increase in El Segundo, because mainly of the PD department.
That answer your question there, Ronson? Okay, thank you. Any other things for Pat? Okay, hearing none, we're going to move on to Sherry Weaver with Harbor Interfaith Services. Sherry?
Okay, good afternoon, everybody, and Happy New Year. I'm sure we're maybe tired of hearing that already, but hard to believe that we're in 2022. So I'm going to start off my report with our interim housing shelter sites, which we operate 3 of them in Service Planning Area 8. San Pedro Interim Housing, which is the county site located here in San Pedro. We currently have 1 vacancy. We've had 23 permanent housing placements, 2 of which have been in the past week. And 67% of our residents are fully vaccinated against COVID. San Pedro, a bridge home site. We have, well, let me rephrase this. We have a capacity of 75. We were at 2 vacancies and now we are under quarantine. So a lot of the residents that we had on site have decided that they did not want to stay through the quarantine, or as they affectionately call it, the lockdown. So we are down to 30 residents, of which 20 of those are positive right now for COVID. We've also got 5 staff members that have tested positive. So we are going through that rather bleak period of, trying to keep residents healthy and safe. One of the things that we've encountered with this particular surge is that the isolation quarantine sites that are generally available through the Department of Public Health are not available. Unless we have somebody that is severely symptomatic, the isolation quarantine beds are not available right now. So what is new to us is that we've actually had to keep people that are positive on site, and to the best of our ability, try to keep them isolated to their bed area, bringing them their meals, and then isolating separate bathrooms and showers for their use. So I think the best term that I can give you right now is it's been interesting. It's not the best period of time, making sure that we try to keep the residents on site. The ones that are on site, a lot of them, have pre-existing health conditions and are elderly. So we are navigating on fumes. And what I mean by that is a very limited staff right now, and very few residents, and just trying to keep, not only personal health, but mental health intact. And then the Redondo Beach Pallet Shelter site, to answer some of your questions, we have no vacancies. We have 21 permanent housing placements. 61% of those residents are fully vaccinated. The waiting list right now is probably got about, I think, 17 people at last count. And a part of the reason for the stagnation, early on, we were able to house quite a few people rather rapidly. These are people that had the financial means to readily go into housing through their own financial means. We offered some financial assistance, some light touch, meaning security deposit, a couple of months of rental subsidies, and then they were able to take over on their, through their own means. One person we were able to relocate to New York to live with their family. and a couple of other ones too that we were able to match to permanent supportive housing, which is a very low inventory of those resources. However, we were able to place people. Then we went through, from December of 2020, we went through this long period of COVID, a very dry spell of, housing resources, whether that be Section 8 or open available units through permanent supportive housing. And then we had emergency housing vouchers come online as of July 1st. So we've finally been able to start, assessing and matching people to that process. And I think Courtney can probably attest to it, is a much longer drawn out process. One, to get the application. And then once the application is submitted and completed, to get the actual issuance of the voucher, and then to secure housing where that person can utilize that voucher and actually lease up. I would say probably the most challenging part is from the issuance of the voucher to lease up is attracting property owners that will accept Section 8, even with some of the incentives, which are $2,500 per lease up. Having individuals that have pets. We just encountered one individual that the owner wanted to charge her $600 pet deposit and $60 a month to have her pet with her. And some of the other challenges include, poor credit histories, no tenant history, and the list goes on and on and on. So, and the fact that we've got 6,800 vouchers countywide, we are essentially competing with one another right now to get whatever vacant units are available. And I think just one other thing to mention too is that many times when you have people experience homelessness, say for instance in Redondo Beach, they tend to want to stay in their communities, and that is not always possible. So having, more of those conversations of looking at other areas that may be acceptable to them that are adjacent to that community, sometimes does a lot of, sweet talking and schmoozing and not wanting them to lose their voucher and coming up with alternatives. And I think the best way that we have been able to overcome that is taking people to a lot of unit viewings. This is actually could be your home, with the understanding that if this is not going to be your forever home after 1 year of being leased up, that you can go somewhere else and take your Section 8 voucher and move closer to the location that you ideally want to live in by porting your voucher. So those have been, I guess, to say some of our challenges. We are getting some headway with, finding some owners now that we are able to lease up with, but just for the interim housing sites, we've completed over 62 applications to date. We've got 40 vouchers in hand, and we have 8 of them leased up. So it is, again, a process, and we continue to work with our housing authorities and our property owners to make that happen. Does that answer your question?
That was fine.
Okay, all right, perfect.
Yeah.
And then as far as the single adult system, our contract started on July 1st of 2021. We have 149 individuals that are new and unduplicated that have been assessed. Households that are being served through either rapid rehousing or recovery rehousing, we have 43 housing placements. Chronically homeless individuals that are being assisted by our housing navigators, we've got 19 more permanent housing. And through our 2 city contracts with Torrance, we have 13 housing placements, and then Redondo Beach, we have 6. In the transitional age youth program, we have 11 individuals assessed. We have 6 that have been placed through rapid rehousing. And I do want to say that, with our youth, what we are finding right now, there are more of an elusive crowd. You don't typically see them, living out on the streets or sleeping in their cars. We do a lot of works with community colleges. So we are trying to increase our enrollments, but it is a rather smaller population, hence the smaller numbers that I just referenced. And then for the CES family system, we've had 122 individuals, households assessed. We have 46 that have been placed with through rapid rehousing, and then another 8 households that were prevented from becoming homeless through our prevention program. 2 success stories I'm going to lift up real quick here. One of our residents at the county shelter, Kathy, the one that I mentioned with the pet deposit, She was homeless previously for 8 years. She was one of our original residents here at the county site. So it's been a long journey for her. I can remember the day that she first came in. She is a diabetic who is insulin dependent, and together we learned how to give her administration of her insulin. Kind of our exchange of information every day is, what is your blood count every day? So, having her at normal levels, because she at one point went into a diabetic coma while she was a resident here. So finally seeing her going into permanent housing is really excited, although we could promise her kind of that we would get it done by Christmas. I think 2022 is pretty close. And then our second person is Alicia. Again, she was one of our original residents. She had been here homeless for 17 years. And she just got her permanent housing last week. She was really excited. It was a place that came fully furnished and literally rehabbed head to toe. And I think the thing that I want to mention with both of these placements is both of these residents wanted to stay in San Pedro. And both of them right now are moved out into the LA area. And again, it was one of those situations where we've taken them to not only to see the unit, but to take a drive around the community to see if they had things like the grocery stores and stuff, that would fit their lifestyle, to make sure that they felt safe in their community. So that was one of the other things that we're doing now too, is taking a drive around, to make sure that they feel comfortable in their community, that they don't feel like there's any threats or violences in their community. And that's what sealed the deal for us. And we got 2 more placements as a result.
Good job.
Any questions?
I see Ronson's got his hand up.
Hey, Sherry, you mentioned that the vouchers, like people could potentially port them. For the Redondo Beach Pellet Shelter, are all those folks being applied through the Redondo Beach Housing Authority?
No,
No.
we got quite a few of them. So we work with Department of Health Services, who's our funder for that site. We give them a list. And they are not necessarily being, I wish that would be the most straightforward way to do it, Ronson. However, they've gotten the county vouchers. Some have gotten the EHV vouchers, which could be city or county. I think we have one resident that has received a Redondo Beach voucher.
Okay. Well, because the reason I asked is it's more complicated, right? Because like if they get a voucher for a specific jurisdiction, they can only use the voucher in that jurisdiction. So for the county vouchers, could they even use it in Redondo Beach because Redondo Beach has its own housing authority, or is there a conflict there?
They cannot. They do not have a joint agreement for jurisdiction to utilize the vouchers in that city yet.
Right. So you only have one person. It sounds like there's only one person in Redondo Beach voucher, so only one person can find a place in Redondo Beach.
Right.
But the others would have to look elsewhere.
Right. And one of the other challenges, Ronson, one of the other challenges too with Redondo Beach in particular is meeting the fair market rent, because rents are so exorbitantly high in Redondo Beach. So if that person has, for instance, a 1-bedroom voucher, which usually ranges in about $16.95, trying to find a unit within that rent range has been challenging as well.
Okay, thanks for that. Yeah, I just really want the task force to appreciate all the challenges with the vouchers. It's not simple as just getting a voucher, but there's a lot of headaches with it too.
Correct.
Okay, Surly, I think you had a question. No? Okay, I see Zane's got a question.
Thanks, Chair. I just want to say thank you to Sherry and Courtney, to the PATH staff and Harbor Interfaith staff for all your tough work during the pandemic, especially. It must be scary. So I appreciate it.
Just as long as we don't run into flu Rona now, that's the one more variant. And I think we're all just going to be so frustrated and fatigued.
It's a challenge, isn't it? Okay,
Yes,
any other questions for Sherry? I don't see any other hands. Okay, so we're going to move on. So next is gaps in housing and income programs. And Ronson, that's you.
Was Nancy before me? Let me see.
Oh, I'm sorry. You're right. Homeless count. Homeless count. on spot. Hey, Nancy Wilcox, I'm sorry, my apologies.
No worries. Thank you. I'm going to do a screen share. Is that okay?
Yes.
If I can get the right, hold on, I want to make sure I get the right, got too many windows up here. Okay, so let me know if you can see my screen okay. Okay, so
Yep.
hopefully you can see that. Good afternoon again and Happy New Year. I'll kind of keep saying that. That seems to be the trend on our meeting. For those of you who don't know me, I am Nancy Wilcox. I co-chair the South Bay Coalition to End Homelessness. Our homeless coalition has been heavily involved with helping the Los Angeles Homeless Services Authority, or LAHSA, organize the count throughout the entire South Bay. We've been doing that since actually the very first homeless count. I personally have been doing that for the past, I don't know, 6, 7 years. This is my 7th year doing it. In this year in particular, I have a more official role. LAHSA has asked me to also kind of help coordinate from their side as well, because they are short-staffed. So I've been kind of stepping into that role just for this year as well. So with that, let's see, I'm going to go over a few things pretty quickly, just a quick overview on the count, but I do want to spend a little bit of time just making sure that all of you understand all of the new COVID safety procedures that have been in place, just so all of you have the confidence to participate yourself, or maybe to recommend other folks to join us in the count. Talk about a little bit about what's going on with our deployment sites, and then some challenges that we're having with this year's count because of COVID, and how we're meeting that challenge. So just very quickly, I think all of you are aware that the homeless count takes place in the last 10 days of January, over a 3-day period in Los Angeles County. South Bay always has Wednesday night, so we're the 26th, and during that one night, our goal is to try and cover every single road mile. So we have about 3,700 road miles we're going to try and cover with our volunteers at one night. And of course, I believe all of you are already aware that these become the official record of what homelessness looks like in our cities. So I'm really asking for your help today, not just in being aware of what's going on with the count, but really helping to promote it within your constituents and your neighbors. I just find, because I've been involved with the homeless count for so long, I really see a difference in the quality of the count when we get a lot of residents, community residents, to come out. They really know their neighborhood, as do you. So that's why we really do a hard push to try and get folks to volunteer within their community. So I'm going to slow down, take a few minutes to talk about the different safety protocols that LAHSA has in place for this year. First and foremost, they are going to be following all the Department of Public Health protocols in terms of using PPE. Everyone's going to be masks. There's going to be social distancing at all the sites. They're actually reorganizing the flow of what's going to happen at the site this year, just keeping COVID in mind. So all those steps are already in place, and we're in the process of training all of our site leads so they can follow all those. The second thing is we're encouraging people to sign up as teams. In past years, people could sign up as a team, but we didn't really emphasize it. So you might have like 40, 50 people showing up at a site. And one of the things we would do is we would be kind of pairing people up. But in the day of COVID, of course, it isn't as comfortable spending an hour and a half, 2 hours in the car with some stranger you don't know, even if you exchange vaccination cards. So we really are encouraging folks to sign up as teams. So you're already identifying those trusted people that are in your household, or close family members or work colleagues that you feel comfortable canvassing the tracks. And lastly, what we're doing is we're minimizing the amount of time spent at the deployment sites. So in previous years, people would spend about an hour at the deployment site getting trained, getting their assignments, getting these, forming the teams, and then we would send them out. This year, what we're doing is we're really going to be pushing for the volunteers to all watch a 20-minute video before they come to the site. In addition, this year, LAHSA is going with a new smartphone app, which is replacing the clipboard for those of you who have been involved with past counts. So again, as a time saver, we're really encouraging people to download that app before they come to the site. Oops, sorry. Okay. The slide is just at our last meeting a couple of months ago, we already distributed this, but we do have flyers available, kind of talking about where all the different sites are. You're welcome to use this flyer. Each of the cities has a site lead. They also have an individual flyer that's been customized for your particular city that has a hot link that'll take you directly to the signups. So I was pulling the number of folks who registered as of Sunday. So I won't dwell too much on this slide, but I do want to let you know that we had a lot of folks sign up in November, December, which is very encouraging. I listed on here the number of tracks that each city is responsible for covering, the number of volunteers, again, as of Sunday. And then that last column, I kind of listed the maximum number of volunteers that we're taking on a registration site. So that number it's a very high number. So I don't want people to kind of panic like, oh my goodness, you only have, a quarter the number of people. That number is based on number one, it's based on pre-COVID conditions. So it also takes into consideration a lot of people are kind of no-shows. So that number that we register online is higher, is usually about 20 to 30% higher than what we really need. So I'm actually feeling pretty good about our numbers. I do anticipate the signups to be a little slower this year versus last year just because of COVID. But again, I'm talking to all the site leads about what to do in case they don't have very many volunteers. But this is how it's looking so far. Just the other thing I wanted to note on this chart is you'll see for the number of volunteers for some of the areas like El Segundo, for example, we have here that they're not looking for any volunteers. And the reason for that is because their law enforcement agency is taking responsibility for doing all the count this year. Which again, we're kind of encouraging any support because of COVID this year. So are there any questions on this before I go to the next slide? Okay, and you're welcome to, to ask me questions about this later when I finish as well. So I do want to just kind of mention what we're planning as well, given the Omicron variant. It's again, we have no idea how that's going to predict signups, turnouts, excuse me. So, we're just taking it a day by day, but, we have some strategies in place so that even if only half the number of people show up that we anticipate, there are some tracks that are more important to try and canvass that night. And those include areas where we do expect to find people, as well as just for some analysis, LASA is also going to give us a prioritized list of tracks. So those are the ones that are going to be going out and hopefully get canvassed that particular night. So anything that isn't completed, there will be an opportunity to cover those in a few days right after the count. We call those makeup tracks. And again, we have some strategies for how to cover those tracks. So there is a lot of planning being done, and we're just going to wait and see what happens, but we're hoping for the best. But if we have a low turnout because of COVID, we do have kind of a plan B. LASA is in pretty constant communication with HUD because they are naturally issuing a lot of guidance as well. So as some of those various guidance are coming to LASA, as I'm being informed about them and as they impact all of our sites, I'm just going ahead and sending our site leads that information. So is there any question on this before I switch? Yeah, go ahead. It's hard for me to see who has their hand up. So
quick question. How do people sign up? Were you going to tell us how people sign up?
Yeah, I will. Oh, okay. Yeah, well, let me go ahead and go to the next slide. So thank you. There you go. Save the best for the last, or the most important. Everyone can register at the website called theycountwillyou.org. And once you get into that site, then it'll ask you for what city you want, and then you have a choice, and it's pretty straightforward from that point on to register. So, and again, there's your site leads have a customized form or a flyer that has a hot link directly to your particular city. So you're welcome to use that. And I'm hoping that many of the cities will post that on your website, so your residents can just use that. But if they don't, theycountwillyou.org works really well. And that was it for my presentation, I just wanted to just very quickly give a shout out to all of the site leads that I have been working with. They've all been wonderful to work with. Many of them, some of them have, this is their first year. Some of your other site leads have been doing it for 6, 7, 8 years, longer than I have. So again, that also gives me a lot of confidence that we're gonna have a successful count because we have so much depth in the folks that are heading up our count this year. And last, I just want to give another quick shout out to all the service providers that are on the call because they also are very instrumental in helping us to complete the count. And a lot of many of their staff members will be taking some of the harder to reach areas that we just don't necessarily want a community volunteer going to. And last, I just want to give a shout out to the city of Torrance. They have been hosting our training sessions and I really appreciate being able to use your facilities. And that was it. So if there are any other questions?
Thanks, Nancy. Anybody, I don't see any hands. So if there's a question, just go ahead and let us know.
I have my hand up.
I'm sorry, Lori, I didn't see it.
Okay. Okay. Well, Nancy, thank you for taking on this role. You're the perfect person to do that, and I have great confidence. I've been promoting the heck out of it in my area. One of the things I stress to people is, you don't have to have experience or have any knowledge on homelessness because people are like, oh, I don't know anything. I can't do that. Okay, this is the opportunity to be part of the solution and really let people know that our resources are dependent on getting this information. So I think that's important when anybody's going to promote this, to let people know this is your opportunity to learn more, be part of it, and you don't have to really know anything ahead of time. I just think that's an important point.
Okay, thank you, Lori, for raising that. I kind of went through the slides really quickly. That is the case. And as I mentioned in this 20-minute video that we're asking volunteers to view prior to coming to the deployment site on the 26th, the first half of it actually goes into a lot of detail about what to look for in terms of if you see someone or you see a vehicle, you're not sure whether someone experiencing homelessness is dwelling in that particular site. So they have a lot of hints on that. And then the other half of the training is how to use this new phone app. So,
and also people need to know they are not going to be interacting with anybody. They're not going to be walking through the park, knocking on van doors. It's you're in your car. That's it.
Yeah, we do ask some people, depending on what track you have, we do ask people get out of your car, depending on, again, your site, to kind of look behind dumpsters if you are in a park. So there's a little, but that's also covered in the training. So, the other thing too is obviously we did not run, we did not do an unsheltered count in 2021. So 2022 is really important because it'll be 2 years, plus with the pandemic. And just the effects of folks who might be, for economic reasons, for whatever, newly homeless folks. This is just a really important year to get as good a count as we can. And again, we do that with a lot of community volunteers. So anyway, thank you again for your support. Oops, was there any other, someone in the chat? Okay.
Thanks, Nancy.
Okay, thanks.
Okay. So I still do not see any of the hands. So with that, thank you. We appreciate that. And we will move on now to Ronson for gaps in housing.
Thanks. And I just want to give a shout out to Nancy. We're so lucky and inspired to have Nancy organize the homeless count for us every year. She's just such an asset in doing that and all the work that she puts into it. So yeah, thank you, Nancy. So yeah, let me go ahead and share my screen. So if you didn't know, if you're on this call right now, that means you are the task force. You're part of the task force. It sounds very, very cool. I know. And so what I wanted to do to kick off the new year is to kind of share some thoughts I've been having about the task force since I started about 3 months ago. And after speaking with a lot of you and looking at things on the ground, I really wanted to evaluate like what is the role of the task force for 2022. And I came up with this kind of statement here. I feel like the task force can help combat homelessness by evaluating data and the situation on the ground in order to identify gaps and offer solutions. So basically to listen and to find ways that we can help our outreach workers, our housing navigators, and then just people that are in the weeds trying to find solutions for our homeless neighbors. So that's kind of what I came up with. And an example of this would be, I was having a conversation with our outreach workers, specifically also Ari from Harbor Interfaith, and we were talking about how like outreach workers were spending a lot of time chasing down IDs and other documents for their clients, and it was just a very time-consuming process. And so the task force, we knew that lots of PRK document specialists, they had this document specialist project that was ending soon as of 12/31. And so we asked LASTA, Yvette, who runs that program, if the document specialist could be redeployed to the South Bay. So we've gotten some positive responses from LASTA, and we're currently working on LASTA to deploy about 2 or 3 document specialists that they have to South Bay to complement our outreach workers. So what this would do is this thus potentially can increase the capacity of our outreach workers. At no cost to us, really just redeploying resources that we already have in the county. So that, I think this is a good example where the task force can really help and to leverage kind of everyone on this calls, our connections, our knowledge, our know-how to kind of help our outreach workers out. And then I further wanted to organize this by 3 priority areas. Number 1, of course, is housing and the shelter. We heard that from the very top from Courtney. What we can do to move people along from our interim shelters is to provide more housing. And we also need more shelters in our area. And that's the feedback I've been getting from basically everyone. We need to find gaps in our income subsidies. We have folks that are literally just a few $100s away from finding housing, but they just have that gap where, if they were to pay for rent, they would have no money left for food or anything else. So we're talking, for some of our clients, we're really close, and we want to identify what those gaps are and where we can fill those gaps. And then 3, services. What other services can we provide? We know there's mental health needs. We know there's substance use needs. Lori always corrects me on that. So those are the 3 areas that I want to look into. And just a little bit more about these areas. So for housing and shelter, what have we done? What have we done at the task force, and what are we looking to do? So what we are hearing is we need more housing. And so what we've done so far is, we reached out to a lot of developers, and we've identified a PHK site actually in Redondo Beach. So right now, Redondo Beach and the developer Century Housing, they're working on a PHK site in Redondo Beach that would open up 20 permanent beds for Redondo Beach. So that's great. So that's something that's actually happened within the past 2 months. It's actually happening really quickly. And the county is now partnering on this project as well, so that we have additional funds to support it. We've actually identified 2 other properties in the area and owners interested in doing something with his motels. We are looking for developers or partners that would be interested. They're kind of smaller motels. They're less than 20 rooms. So it's kind of tough for PHK, but there might be other opportunities like a master lease of those hotels so that we can have rooms opening up again for our homeless neighbors in those motels. So I'm currently working on that, finding partners to see if anyone's interested in helping develop these 2 hotels into something we could use for housing. We are actively researching housing trust funds. We're meeting with a lot of affordable housing developers, and we've been having great meetings. They're all really excited. There's a lot of money being poured into this area of housing and building affordable housing for those in need. And so we're trying to figure out ways to how we can bring that money to our area so we can build more affordable housing for our workers. And it's not even necessarily homeless housing. It could be just workforce housing, just making sure people are not living paycheck to paycheck and being housing secure. And then, you've heard Lori talk about Home Share South Bay, and we also want to promote lease up just to, again, build more inventory. One of the projects that we're looking to do this year is identify more, Section 8 friendly landlords, or just landlords that are kind of friendly to our cause, willing to help. I've been talking to a lot of amazing property managers that are very compassionate and are really interested in trying to help our homeless neighbors. And so we want to identify more of those property managers. And then, of course, we're doing a lot of legislation advocacy. how we can get more vouchers. The emergency housing vouchers are great. How we can do more of that, and other types of advocacy were needed. On the shelter front, we've been talking to Caltrans and Metro, trying to find locations and sites where we can build. Unfortunately, there's not, we've kind of struck out on a couple. We were looking at some Metro parking sites that won't work, unfortunately, but there are some Caltrans sites that might work. However, there's some environmental issues with those sites. I'll just leave it at that, but we're kind of looking into that. Always looking for pop-up sites or seasonal sites that we could use. We could always use more winter shelter sites, especially the recent rains that we've had. It was great that we had a site up and running in the Laundry Park area. And then we have our winter shelter site that's in Long Beach. But we could always use more. You never know when there's going to be, knock on wood, but like a disaster around the corner. So having sites ready to go is always a plus. And then our innovation fund. Our innovation fund is funding several beds on this next round. And then we have the Torrance interim shelter that we're supporting as well. And one of the ideas that we have is, how can we have more demographic-based shelters? It would be great if we could have shelters dedicated for mental health people experiencing domestic violence, families, seniors, things like that. So, so we kind of focus and help those different pockets of need in our area. So those are things that we're looking to do on the housing front. On the income subsidy front, like I said, when we've been shadowing outreach workers, it seems like, we're really close on getting some of these folks houses. There just isn't enough money. And like Sherry mentioned, our rents are just so high in our area. And so, our next presenter is actually going to present about shallow subsidies. The Salvation Army is here presenting their program, which I'm kind of learning more about. I think is really interesting. So I'm really glad they could join us today. We need more rapid rehousing slots. How can we advocate for more of those? Like I mentioned, legislation advocacy. And then one of the things that I want to do too on the task force is to get more organized, do a subsidy matrix, if you will, to kind of figure out what all the different subsidies are, what demographic groups they go to, and how they kind of play a role, so that we're more knowledgeable and organized about everything that's in our arsenal that we can deploy for our clients. Other things I've been hearing is just needing access to immediate aid. I just got an email today from an outreach worker. Their client's car got towed. That's the only thing they have. They're homeless, and they've been sleeping in their car. Now the person is just on the street. And so, we need client aid to get the car out of the tow so that the person can get his car back. If he has a job, he can continue driving to work. If not, he could be fired from his job, and that would worsen the situation. So aid like that is much needed. So what we're doing is, we have this client aid program. We're looking to revamp it for this next 18 months. And I'm going to tell the group more about it once we have some of the details more fleshed out. But look for that on the horizon. And what we want to do is provide aid more rapidly to our outreach workers so that they can cure really acute needs that can't wait like two weeks or a month for reimbursement. One of the things we noticed too in listening to our data, it looks, we just saw this stat the other week where it looked like other areas, other spots are using more of the problem solving funds than we were. For example, the San Gabriel Valley, they use 3 times more, or at least they have 3 times more problem solving cases than we do. And we have the same type of homeless count numbers. So that was really interesting. And one of the things I want to do is look into that. Like, why aren't we using problem solving more? Maybe we're not coordinating enough with LASA and problem solving in our area. So that's something I want to look into as well. On the services side, let's see, we have, we've heard that there's a need for mobile mental health response. So we're working with the county on the psychiatric mobile response teams. There are these vans that they're looking to partner with municipalities on to launch in anticipation for the new 988 number that's launching in the summer to help with mental health needs for people. So instead of 911, they'd be diverted to this new number. And as part of that, the idea is to have these mobile mental health response units so that it's not law enforcement. It's the care that people need right away. As part of that, also, Hawthorne recently launched a telehealth van service that is really interesting, and what I really want to do is just monitor how that's going. I was at the launch there and got to meet Council Member Montero, yeah, it looks like a great program. And it's not just telehealth; they're doing things, everything from mobile. They're even doing mobile legal curing, like diversionary programs using the telehealth vans. So if someone maybe has an infraction, they can attend some sort of diversion kind of clinic in those vans to kind of cure those infractions. So that was kind of interesting. And I'm looking to work with the police chief over in Hawthorne to see how that's going, and maybe if there's a role for that across the whole region. And on the mental health side and substance abuse in general, there's some new programs coming out. CalAIM is coming out. I'm still learning about it. It's a lot of information. I think eventually we'll have them present at our task force meeting. That is the new program which they have kind of revamped the Medi-Cal system to provide more services for mental health, substance use. Some of these higher acuity needs for to provide recovery beds and just more services for those folks. So that's coming along the pipeline. Venice Family Clinic, big fan of them. They kind of pioneered street medicine outreach in Venice. They've expanded to the South Bay, and I know there's someone on the call today from them. So I welcome them and looking forward to partnering with Venice Family Clinic to bringing their services to our area. I think it's terrific. And then in this area, there's also legislation that we could possibly do. Looking at conservatorships, seeing if we can do more to get people the help they need. We are also part of the Blue Ribbon Commission, which maybe is not necessarily just mental health and substance use specific, but the idea here is that on the Blue Ribbon Commission, we're looking to see how we can get more services into our local areas. One of the kind of gripes is that the Measure H funding isn't coming back to the localities that it should, and how can the county restructure LASA maybe so that more money can come back to our local communities. The other thing that we're working on is capacity issues. Sherry mentioned that she's had a lot of outreach, a lot of her workers calling out sick. We know that there are a ton of open positions across the South Bay. And so how can we better expand the workforce and retain staff? That's something we want to look into. We also we're kind of running out of room, office space at our nonprofits. How can we get more space? Maybe even have access centers. Just having more capacity to serve our client population is something that we want to look into. And then just something really quickly, Hygiene Kits kind of builds trust amongst our outreach workers when they give out the Hygiene Kits to their clients. We have actually 3,000 Hygiene Kits that are going to be coming donated to us by a company called Securian Financial. So some of you guys have gotten an email from me. We might be dropping out some Hygiene Kits to you soon. So those are just some of the things, some of the services that we're going to look into to kind of help, again, our homeless network here in the South Bay. So is there anything else I missed or any comments, ideas, suggestions for 2022? Feel free to come in.
It's Lori. Yeah, I would think on the housing, you might want to add ADUs to adding more to housing. We could work on that. And then I just wanted to mention, because you were talking that Diana was asking about the winter shelters, and Max kindly added notes in the chat with the link to the winter shelters. My understanding, most of them have been extended because of the cold weather, but he does bring up the COVID, the quarantine issues too. So I don't know if there's an update on winter shelters as far as quarantine.
Yeah. Yeah, I haven't heard anything about the quarantine, but I know like they did extend the pop-up, the weather activated sites. I think when it was raining really hard again, in that second week. And then I'm not sure the status on the weather activated sites. But then there is that Long Beach site that's going to be open through to the end of March, I believe. Jackie?
I wanted to mention that I think it's fantastic. Ronson has really put everything out there and given us a lot of food for thought, and I think she's doing a great job. But I do want to respond to Lori's comment. We actually have money from SCAG at the Council of Governments to research ADUs, how they're working, how to promote them, how to help cities, and we're doing that through the community development directors. So without this committee doing that much, we could just get reports from the community development directors. I'm not sure that should be a task of this committee. Thank you.
Okay, thanks,
Thank
Jackie.
you. George?
George?
Yeah, thank you. Ronson, I think you mentioned there are some folks, you said, I think earlier in your pitch, where they're very close to get housing just because, you know, it's a financial gap thing. And got me thinking is that a very small percentage number? Here's what I'm thinking. I'm going to get immediate to it. That means these are folks who have jobs, who's willing to work, and they're just missing it a little bit. And then compared to the folks we're working with, are a lot of the folks willing to start at least some place to start getting a job, so some could eventually get to the place where some of these folks are just nearly, you know, missing. They just need a little gap help. I'm just wondering, because I always wonder, you know, when I drive by and see people, I actually wonder a lot of times, are they willing to work?
Mm-hmm. Yeah, I think the answer. So yeah, there's definitely a population of folks, and I don't know, I don't have the percentages, and this is something I want to look into. Is I think you're right on, George. Is like, how can we you know, slice and dice this population, because it's not a homogeneous population, right? They all have different needs and different issues that needs different solutions to solve. And so for the folks that can have jobs, you know, it's a matter of like, yeah, there is like a gap. So like, you know, one of the issues is rent deposits. You know, like you may have a job, but you don't have $3,000 laying around to pay for the first month's deposit. And so that's where problem solving comes in, where they can give that $3,000 deposit that they just don't have. You know, if you're living paycheck to paycheck, you have no savings. And so you just can't afford that, or even paying a speeding ticket. You know, and on average, you know, when I was at the homeless court, on average, people had 3 speeding tickets that had these tickets and had these issues. And each ticket cost $800. So that's $2,400 of something that they were obligated to pay. If they did not pay it, they had bad credit, and they couldn't. And they might have a traffic warrant out. So then they can't pass a background check. So these are folks with jobs, but with bad credit and can't pass a background check. So there is a lot of different issues, even with people with jobs, that are preventing them from getting housing. So we need to look at that separately. And then for the folks that don't have jobs, you know, I have to say, like, you know, we all hear the horror, we sometimes hear the stories of people that, oh yeah, they're just living off of unemployment insurance or things like that. But there are, you know, from what I've seen, I've not encountered as many of those folks, but folks that truly have like mental health issues, health disorders, disabilities that are really preventing them from getting jobs. And in those instances, kind of the same thing. They are getting financial aid, they are getting, you know, like general relief funds or SSI benefits. But, you know, same thing, like I just helped a lady who couldn't pay the deposit. So Client Aid paid the deposit for her. It was a $2,500 deposit. And that was the only thing preventing her from getting housed. And so we paid it through client aid, and now she's housed with her 8-year-old daughter. So those are the types of things we want to do, fill in those gaps so that we can get more people off the streets.
Thank you.
Diana?
Yeah, sorry, just wanted to clarify. You said the Alondra Park shelter was going to be extended until March.
Oh no, the Long Beach one. The Alondra
the Long
Park is
Beach.
weather activated, and so I'm guessing it's probably not open right now. But yeah, I think Lori mentioned there's a LASA link, or Max might have posted a LASA link in the chat where you can check to see updates on those winter shelter sites.
Okay. Thank you.
Okay, anybody else? Zen?
Sure. It's something I just wanted to piggyback on the prior presentation is that since our resources are reliant upon how many homeless we count, and this is a kind of regional problem rather than one isolated to Redondo Beach or anywhere else, I'd encourage all the electeds, all the people with access to disseminate information in their cities to really promote the count and try to get us, as many people out there counting as possible so we get the most accurate count and therefore then can get the most amount of federal, state, and county resources. So, for example, I'm putting together a little graphic to put on social media, but whatever you have at your disposal, whether it's emailing or the like, I'd encourage everybody to try to promote that count. Thanks.
Thanks. Yeah, it does have an effect on Measure H money. Joseph?
Thank you very much. And I echo all the appreciation for the help, with services. So a quick question. What are the hours of the count again? As I recall, that went pretty late into the evening.
10.
Yeah, I'm not sure if Nancy's still on, but I'm the site coordinator for the Redondo Beach count. We're gonna start setting up the site like around 6 o'clock.
Yeah, Bronson?
Yeah.
Yeah, let me jump in. So part of it depends on the site, but we're asking volunteers to come at 8 o'clock. Quite frankly, I think a lot of sites are going to be open sooner, and because we want people to, we want to process people as they come. Let's say you come 15 minutes early. My guess is if you and your teammate or whatever are ready to go, you can just, go on through the line, so to speak, and you'll be in and out of there. Hopefully you'll do your homework ahead of time. And if you have, then you can be in and out of your site in 10 minutes. So, and if that's the case, you probably it'll probably take you from about an hour, maybe an hour and a half to canvass your tracks, depending on how many tracks you get. So
okay,
it won't be a late night. Thank you.
Okay. And then a comment, because the agenda item says gaps in services. We've been fairly successful, with our homeless partners in getting people to go back to their families. I didn't see any of that listed, on any of the percentages of and achievements and the like. We've been quite successful with that, I believe, in 3, possibly 4 circumstances where we actually repatriated them with their families, which I think we all would have to admit there might have been some reasons why they are homeless, leaving home, but going back home and having the support of family members and the like is probably gonna have the best initial and ongoing results. But we found some gaps in, and fortunately, we're very lucky here in Manhattan Beach. We actually have a former Manhattan Beach Task Force, homeless task force group that stayed together afterwards, and they raised money and resources to kind of fill those gaps. And those have been for transportation to get those people back to home. I think the majority of them have been from out of state. So I would just encourage everybody to consider that. I would almost move that to the top of the potential solutions, because everything we're talking about, developers and developing new units and everything like that is very, very expensive. So I would just want to encourage everybody by telling our encouraging news that we've had here in Manhattan Beach. And those people would be, it's called MB Safe, and they would be willing to talk with you as well about what they do.
Thank you, Councilmember Franklin. Yeah, so like I'd say like maybe 4 years ago, LASA recognized exactly what you're talking about, is that instead of sitting down with clients and just talking to them and asking them questions like, oh, do you have family you can stay with? You know, if I buy you a train ticket, could you go somewhere and be housed? Those conversations weren't happening. And so they rolled out a program called Problem Solving. And it was very organized. Anna, who was on this call with PAF, she was actually part of the problem solving program. And so problem solving started training our outreach workers to have those conversations with our clients. And I mentioned problem solving in my slide. So we're looking at the data on problem solving. San Gabriel Valley had like 3 times as many problem solving cases open as we did. Yet our homeless count numbers are roughly the same. And so that's an example of exactly what you're talking about, Councilmember Franklin. It's like, why is that? Are we not having as many conversations in problem solving, or what's going on there? So that's something we want to dive into, and making sure that we are using that resource. And problem solving is not just the conversations. They provide funds to buy that plane ticket or train ticket. If maybe they owe their mom $500 and they're kind of avoiding their mother, but if we pay that $500, the mom will let them back in the house. Just things like that, that we're looking, that the problem solving is there for.
Okay, we're running a little behind, so I'm going to move on. If you have any questions for Ronson, go ahead and try the chat. Okay, so we're going to move on to shallow subsidy. Jennifer.
Hi, I'm Daniel, and Jennifer, I don't know if she's going to join us today, but I'm the supervisor, and the program I'm presenting on today is Street to Subsidy.
Thank you, Dan.
Hi, everybody. So Street to Subsidy is a branch off of the Shallow Subsidy program. It's under the same contract, but we just target a different group of people. If you are familiar with Shallow Subsidy, they have their 35% of the rent for 5 years, right? We work similarly. We do 30 to 40% of the rent, but the main difference is that instead of targeting folks that are coming out of rapid rehousing, we're targeting folks that are currently homeless. So we also provide more case management. Opposed to Shallow Subsidy, they do very light touch. And then the other thing is for Street to Subsidy, someone in the household must be on a fixed income. So if I can share my screen, I'll go over my presentation.
Yes.
Are you able to share your screen? Okay, great.
Great. Everyone see the slides?
Yeah.
Awesome. Let me go ahead and make it full screen. Okay, so I'm going to go over what Street to Subsidy is, who's eligible, who can be referred, referral process, services provided, overall process flow, and then give some time for questions. So Street to Subsidy, as I was saying earlier, we are a rental assistance program. We target folks that are, with the household that has a fixed income. It doesn't have to be the head of household, but someone in the household. And then we are time limited, so maximum period of assistance is 5 years. We provide case management services as well. That's housing related, so we can support their housing stability. And for eligibility, folks that are currently homeless or they've been newly housed, so less than 30 days. So when a household has a fixed income, but then they could be a combination of different incomes. And then the household must have already identified a unit with or without the assistance of a homeless service provider or like the referring agency. It doesn't have to be a rapid rehousing or that sort of program. It could just be someone that's in the CES entry point networks. Someone just has access to HMIS and they can provide just the basics with providing proof of homelessness, that loss of form, I think is observational homeless status, and then helping the client with preparing some of these documents needed for the referral packet. And then, so the household must be referred over. It's not a direct, they don't just call in, it has to be with a service provider. The household must be at or below 50% AMI. They must be able to perform their activities of daily living or have a home health aide that would be able to assist them. because we don't provide that service. And then also if ICMS or mental health mental health services are required, then they must have at least been connected or starting that process to be connected. As again, we don't provide that service. So. Fixed income. The things that we count as fixed income, the most common ones is disability or Social Security. So SSI, SSDI, VA service or non-service connected disabilities, pensions, private disability, or Social Security retirement survivors benefits, CAPI for non-citizens with disabilities, and then any minors or other non-head of households with fixed income. Ones that we do not count are general relief, CalWorks, child support, alimony, or employment or unemployment. None of those count as a source of fixed income. But it could be a combination, as long as one person in the household has fixed income. Services we provide. We do provide the first and last month's rent, so double the amount of security deposit and then the first month's rent. And if there's any deposit or remotes that are required by lease, then we can provide that as well. And then the rental amount is tailored based on the household's income, budget, and rental costs. So what we're considering is how much is the rent compared to the income, what utilities are they responsible for, do they have any garnishments, what medical costs they have, like maybe just monthly, like for prescriptions. And then it all gets calculated. And on average that I've seen, it's max of 40%, but then it could go down to 10%, but I haven't really seen it under 30% really. But of course, the household will have to be able to pay the remaining rent amount. So, if you cover 40%, then they have to be able to cover the 60% of the rent. And then, we also consider that they should have enough money to pay for their other bills and needs as well. So, if it's really, really close, like 60% of the rent is like all of their earnings, then we would have to be considered, because that might not be a good choice for them. They may have to find something cheaper. So the other thing is max assistance period of 5 years, and then we do annual research. And then the case management services we provide. So one of the biggest things we're doing is pushing folks, or all of our program participants, we have them do the housing voucher interest survey, and then we're pushing for EHV for them. So the idea is that the 5 years that they're in our program, even before EHV was available, can be like a period of time where they can apply for Section 8 and get picked off the wait list, right? So it gives them that time that they need in order to get processed in that way. But then if they decline Section 8 or affordable housing wait list, and the 5 years runs out, then we would have to stop services at that point. Next slide. So the referral process. The referring agency determines if the participant is eligible, and if they are eligible, gather the referral form and all the necessary documents and send in the referral packet to the S2S email address you see there. In the packet, you'll need the referral form, ID, income verification, the loss of homeless verification. Observation of homeless status would be the one there. Our intent to rent form, or if the landlord does a lease and they do it for like a future date, that works as well. Or if they've moved in within the last 30 days, that lease agreement, and then the owner's W-9, and then budget sheet. It's a Salvation Army budget sheet that we use to calculate the percentage that they'll be covered for. And then I can send out all these documents to you guys after this presentation, so you can have that. So this is the cover sheet, and then as you can see here, these are the things you're looking for, and then as well as this, you can ignore the middle section, that's for regular child subsidy. Just filling in the HMIS number, the referral form, government ID, home, like all the things I was mentioning earlier. And then habitability inspection form is in here as well. If your agency doesn't provide habitability inspections, we would have to do our own before we can actually go through with the referrals. So we have to make sure that the unit is habitable. It's not just like some garage with no bathroom and that sort of thing. It's got to be a home, right? And it's got to be in good condition. And then budget form W-9, proof of property ownership. Again, if you guys can't get this from the property management company or the owner, then we can go on to Property Shark and pull it up ourselves. But if you guys are able to get that on your end, that'd be great. And then a copy of the lease or the intent to rent, depending on which one you guys have. And then if you guys have already assisted them with applying for affordable housing, EHP or Section 8, we wouldn't want to double the work here. And if you guys have started that process, and just any supporting documentation so we can continue that work you guys are doing. Next slide. This is the referral form. So it's pretty self-explanatory, but the first section is for information about the applicant. Section 2 you skip because that's for regular child subsidy. Section 3, their homeless status, their income status, and the source and all that. And then your information. Then Section 4, sign and certify, and then also include your program manager's name and phone number. As you see, like case manager's information is here, program manager's information is there. Then you leave that Section 5 for us to fill out. This is the same form that we use for referrals for child subsidy, traditional. And then you would just do the reverse, so skip Section 3 if you're going to send a referral for child subsidy. And that email address is just childsubsidy@usw.salvationarmy.org. And if you guys want a presentation on that again, then we can schedule that shortly. And then next, this is the budget sheet I was talking about earlier. This is something you go over with the participants. What you're looking for is rents. Do you have any utilities that they're responsible for? And then you're helping the participant think about like how they need to budget. So talk about food, medical we consider in their calculations. So for sure, if they have a monthly fee that they pay for their medical insurances or just like for their prescriptions, and if they have any debt payments that they have, any garnishments, just include that. And then you could just write it. If there's anything like other than, you could just, there's 2 blank lines there, you can just add it in. And then the deployment, income information, please include all sources of income from all the members of the household, and then just filled out and signed by both the case manager and the participant. And this is also part of the referral packet. Referral process. So after receiving the referral within 72 hours, we'll notify the referring agency whether we're going to accept the referral packet, or maybe if there's something that's missing and then we need some more information, maybe a missing document. And then, we'll also determine based off of that budget sheet, determine what the subsidy amount will be. And then also based on the rent amount, right? And then our staff will complete a screening tool worksheet to determine participant eligibility on our end. And what that looks like is just a quick questionnaire. Are they currently homeless or recently housed? Are they at or below 50% AMI? Is someone on the household on fixed income? What kind? Did they identify housing already? Can the household afford the unit with the subsidy combined? Are the members of the household able to perform their activities of daily living or have an assigned caregiver? And if ICMS services are required, have they already been connected with the proper service provider? And does the household reside in LA County? So those are the things we're looking for. I think just it's good to keep in mind because that's what we're looking for. So you just make sure that on your end, these apply to your participants. And then once everything's good, referral packet's good, and we checked off those things and it all came back as yes, then we'll go ahead and send an email saying that yes, the referral has been accepted and approved, and this is the amount. And then we'll send over it's like 3 or 4 documents just for the household to go over, just like intake documents, participation agreement form, HMI's consents, grievance procedures, and client privacy policy. Yeah, so that will be sent out along with the acceptance email, and just to have the household fill that out, and then we'll go ahead and enroll them in the HMIs. Process flow chart. So it's just a visual representation of everything I was just going over. Starting from referring agency, working with household to decide, identify housing and then determine eligibility. gathering documentation, then sending the referral packet, and then if they haven't signed the lease already, then signing the lease, and then making sure once the lease is signed, we get a copy so we can release the funds for security deposit and first month's rent. I don't know if I mentioned this, but we are providing the first full month's rent and then that security deposit. So the subsidy for the individual they will have to start paying their portion on the second month. So that's a good thing to know. Then keeping a household in your program until confirming that they did and all the payments were paid. So just approximately like 3 days from the referral being sent over. And then making sure that all the documentation are legible and uploaded. And then we'll go ahead and continue our services on our end based on like the annual certification. And then I see you have some hands. So this is the time for questions. I can open it up with Ronson first.
Yeah, thank you, Daniel, for the presentation. I mean, this is great. This is kind of feels like a gap that we've been seeing where someone might be on like SSI, but they might just have like a few $100 gap between that and what they can afford in rent, and so it sounds like this can come in and help alleviate that problem.
Mm-hmm.
And so on the eligibility criteria, so you mentioned household. So I take it families are able to qualify for this. It's not just individuals.
Mm-hmm. Of course, yes.
Okay, and then because families may need 2 or 3 bedrooms, does it matter? Like, because and then with a larger apartment comes a larger rent. Does that play into it at all?
I think it's more of a numbers game. We're talking about will household be able to afford a unit with just our subsidy? They of course would have to be approved for the unit, but will they have enough money to survive off of with the remaining money? And then the other thing to consider is if we are we are going to be trying to assist them with applying for Section 8 and that sort of long-term subsidy. Federally, I believe their rules are like 2 people per bedroom. So, it might be a thing if they don't get approved for more bedrooms when they, for more bedrooms when they get the actual voucher, they may have to move at that point. But these are just things to consider. But yeah, I mean, again, it's just a numbers game. If it financially makes sense and it's affordable, then I don't see a reason why not.
Okay, and then are seniors eligible too?
Of course, yeah. We don't have an age requirement, or we're kind of just open to all populations here, as long as there's someone that has that.
Yeah, that's a gap we've been seeing too. Like senior with $1,200 a month in Social Security, rents $1,500. There's that gap there.
Actually, a lot of our current participants are seniors, so yeah.
Okay, that's great. And then last question. So you mentioned Section 8. I was a little bit confused by that. If they're currently on Section 8, they wouldn't qualify, right? Or
no, we wouldn't be able to subsidize on top of another subsidy.
On top of the Section 8, okay. So it's more like you would then look to help this person apply for a voucher, to get off this child subsidy.
Right. So the goal is that they graduate out of our program and get a higher level of care. Being the Section 8 would be a stronger subsidy than ours. I think they pay 30-40% of their rent or the income rather than what they would pay with us of 60 to 90% of their rent, which is, still pretty hefty if you think about it, but it's something to help them kind of just get by, because it's not, at the end, they probably only have like a couple $100 left for their living expenses and everything else. So really the main ultimate goal would be to get that long-term subsidy. And we're trying to give them the time and assistance in order for them to do that. Yeah.
Okay, great.
Janet?
Hi, Daniel, that was a great presentation. And Ronson, I thought your follow-up questions were fabulous. So first of all, I wanted, as the staff member for Congressman Ted Lieu, we often get phone calls. and people are needing us to refer them to other people when they have problems like this. And so, but one of my first questions is, who's funding this?
This is funded by the Measure H. It's by LASA. It's a contract through LASA. So
Okay, so it really is a county program.
yes.
And so I'm personally having real difficulty with the fact that you have to be absolutely homeless before you can qualify for this.
Right.
I mean,
So
there's so many seniors who call us and say they're about to raise my rent outrageously, and I can't. I'm going to be homeless. So are we going to have to tell them, oh, you got to go sit on the street for 6 months before you can qualify for this?
We're not actually like, it's not like we're looking for chronically homeless individuals. You know, it could just be like a day, but for folks like that, I would I think the process would be better if they went through HP and then through shallow subsidy to the traditional shallow subsidy afterwards.
What's HP? What's HP?
So I'll start from the end and move to the beginning. So shallow subsidy has a carve out for seniors only. I think 62 plus, and for folks that are coming out of homelessness prevention programs, that's what HP is. They are eligible for shallow subsidy, traditional. And then what homelessness prevention programs does is helps folks with, if they receive like that notice to vacate and that sort of thing, just due to unpaid rent, those HP programs will come in and pay those arrears and then try to stabilize them. And then once, you know, they built like a 3-month track record of making some portion of payment to their rent, then they can get referred over to the traditional shallow subsidy at that point. I think that would be a better
And who do
route.
we contact for that?
For HP or for traditional
Well,
shallow subsidy?
again, we're getting lots of calls from seniors. So should I send them to shallow subsidy first? And if so, who do I send them to?
Oh, it would have to be HP first, because shallow subsidy traditional, they would have to have gone through rapid rehousing or HP first, and then been
Kathy,
stabilized.
Hetzer, by the way, sorry, just to jump in. That's Kathy Hetzer in our SPA. She does all the housing prevention for seniors, and so yeah. I guess what I know, this is all very confusing, Janet. I hear you. That's why we need that subsidy matrix, so we can like better suss out, like, which subsidy fills what gap. But yeah, so like I guess what Daniel's saying is that in the case scenario that you brought up where the senior is not yet homeless, there is a county homeless prevention program that Kathy Hetzer heads up. She's with Harbor Interfaith, and she can help with that scenario.
Great. I just needed that information. So as I said, presentation was fabulous, and I appreciate the additional information so that we can help other people.
And then for that scenario, if they end up becoming homeless regardless of like HP, and just like the landlord just doesn't want to work with any of the agencies and they don't want money, they just want them out for whatever reason, unfortunate for them, they would have to become homeless, but then at that point they would be eligible for us if they have that fixed income. So, it's just knowing what's available and what situation becomes eligible for which program, right? Yeah. So, any other questions? I see some in chat. Okay, so PATH has a prevention program. There's a LariaB@epath.org. That's in the chat. There's prevention programs all over the county just based on the spas, I believe. And
Daniel.
Oh,
yes.
well, hang on a second, because I had my hand up first.
Go ahead, Lori.
Gonna be pushy. Well, first of all, Janet, thank you for being so involved, and you're asking so many good questions. It is complicated. I've been trying to create this subsidy income thing for Ronson, and because there's no two cases that are the same, it is extremely convoluted. I will say this though, and from talking to Kathy Hetzer, there's a lot of programs that supposedly the resources are not available to you unless you're already unhoused, but there's ways around that. If you can show you are imminently in danger of becoming unhoused, there's ways, and Courtney and Sherry can help with those type of situations. And I've reached out to Kathy Hetzer. She is Adult Protective Services Prevention. And so while we make statements like you have to be already homeless to get these resources, there are some cases, there are some workarounds. I'm not sure with Daniel's program how that would work, but I just want to make sure I'm reading the chat too. Everybody's just like, this is so complicated. Yes, it is. And Ronson is working very hard to untangle and simplify something that can't be simplified. So just keep reaching out with your situations and we will try to find the right resources.
We'll take one more question with Alexander.
Thank you, Chairman. The question is, if it is possible to simplify this presentation in like an effect sheet that can send it to us, because like one of the person mentioned that we got a lot of seniors contacting us that they, cannot pay their rent, they're going to be homeless because the rent's going up. Is there a way that we can get this information in a simplified way, so then we could refer seniors?
We do have a flyer, but again, this is a referral-based program. So just handing out the flyer to any senior that's facing homelessness wouldn't be the best.
But we can channel them to the right direction, right?
Right. So it would be good for you to just be able to see it in a snapshot. The flyer would definitely be for the service providers to be able to understand the program at a glance, at least the gist of it. So you don't have to flip through the pages of the slides, but
correct.
Yeah, just to, I do have a flyer that I can send out as well with all these documents today.
Yeah, especially with all the the information about HP and who which website or which contact that is the best for them.
That would be separate. That's not our program. I was just saying, like, that's what I would recommend if it was me and my the person I was trying to assist. But HP is a different program. Ronson mentioned with Harbor Interfaith, and then there was another person that mentioned with Path. That wouldn't be our agency. Maybe you want those flyers as well, probably.
Yeah, because you did. Someone did mention that before we refer them to the street to Subsidy, right, to the Salvation Army program, they would have to go to the HP first.
I was saying that if someone aren't homeless yet, and they're facing homelessness, it's probably best to go through homeless programs. HP program first, which is a different agency. And then later on get referred over to our traditional shallow subsidy, which is a different program from where I'm in right now, but it's our sister program. Just saying, like, that's like a path that they can take. So essentially anyone that's coming out of a rapid housing program that can get by with just 65% of rent, could pay 65% of the rent, because the shallow subsidy traditional is 35%. They can get referred over, but for 62 plus, if they're HP, they can also be referred over, and that's a different presentation altogether too. There's a lot of different programs here that I'm talking about in order to make this all work. But just trying to utilize the right resources and seeing that path. But again, it's just those HP programs are different agency run, so I wouldn't be able to be the best person to give you the information, but I think Ronson and who's this? Courtney mentioned an email for someone in Path.
Ladia.
Yeah. Okay, so let me interrupt for a minute.
Thank you.
For the sake of the other speakers, we got to move on. But what I'm going to recommend is that Daniel, Ronson, whoever has any information about this, please put your email address in the chat so that people can contact you directly to maybe further ask questions about, it is complicated. So if you have questions, please just contact them personally, and hopefully that would help. So for the people that are still remaining, we're gonna move on. So we have, let's see, client aid process, Measure H, Ronson.
Yeah, actually, let me just combine the client aid and my other announcements all together with the Birch Movement Commission. Okay. The client aid, as I mentioned before, we're still working on it. We're rolling out a new client aid program that will be bigger and better, hopefully. But we're still working on some of the details, so I'm not quite ready to share yet.
Okay.
On the Blue Ribbon Commission, there is a meeting tonight, actually, at 6 o'clock. If you're interested in joining, they're going to be talking about the housing authorities and how the role they play in our homeless systems. So that will be the topic of conversation. The last BRISH meeting was kind of interesting. They asked the question, is LASA doing too much? That was kind of the question put forth to the commissions and commissioners, and it sounded like the majority of the answer was like yes. You know, it seems like LASA was stretched a little bit, and that was kind of the main takeaway from the last meeting. So that's the update there. Christian is still carrying the torch for us in the Blue Ribbon Commission meetings, and looking forward to seeing him there tonight at 6. Homeless Innovation Fund, the Measure H Innovation Funds. So we've gotten some MOUs back from the cities, which is great, and we'll be looking to execute those shortly. However, our SLW with the county is being delayed somewhat for good reason. We are actually getting our Innovation Fund 1 extended. We had some underspend on client aid and at our Redondo Beach Homeless Court, and so we're going to roll over those funds to the homeless to our SLW for the Innovation Funds 2. So we'll have a little bit more money in the Innovation Fund 2. So that's still, I'm hoping to get that contract done in January, and with our steering committee approving it sometime in February in our board. So that's kind of the status update on the Innovation Funds. Thanks.
Okay, any questions for Ronson? Okay, seeing none, we're going to move to legislative updates. Jackie? Or Ronson, do we have
I'm
any?
sorry. We don't really have, our legislative committee is meeting tomorrow night at 6,
Right.
at 5. And so we'll have more updates then. We have no current legislation that I have to report on.
Okay, thanks. But you do have any COG updates?
COG updates, we're working right now on preparing the General Assembly, and it's March 24th, 2022. We're currently planning in person, but we'll be discussing whether that will stay in person at our meeting on Monday, our steering committee meeting. It's going to be really exciting, I think, General Assembly this year, where our chair, who is an entrepreneur himself, is inviting other entrepreneurs and venture capitalists to come and talk about how they look to the future and what they see as where they're putting their money, essentially, and what that's going to mean for cities. And we also are going to be talking about climate change impacts and how they're also addressing those impacts. So it's a real public-private sector event, and it's going to be from 8:30 to 1:30 at the Carson Community Center. And you'll hear a lot more about it as the months go on. So thank you very much.
Okay, thank you. Ronson, you mentioned that there's a meeting tonight with the Blue Ribbon. Is it possible that if anybody wants to attend, you could put that link in the chat for anybody that wants to jump in on that?
Yeah, I'll do that right now.
Okay, thanks. I appreciate that. Let's see, let me check the chat real fast because there's like 17 messages in the chat. We'll make sure we're not missing anything. I think we're good. No, shoot, let me see what happened here. So if you're in the chat, there's a lot of information about websites, how to reach out to people. So if there's any questions, please look at that chat room and write those down so that you can actually make a contact with somebody. Does anybody in the group have any announcements at all to make at this time? Okay, I think I have one announcement. If you saw on the notification of Homeless Task Force meetings, there is a calendar that you can mark for the next few. I think we're March 2nd, May 4th, July 6th, September 7th, and November 2nd. So mark those in your calendar so that you'll know not to miss this. And I really appreciate all the speakers today, because the information today was something that was, some of it was new. It's really important. It is somewhat confusing, but please reach out to those that spoke today if you have questions. And we really appreciate your attendance, and we thank you for your time for attending. And we wish you all Happy New Year. So with that, with no questions, this meeting is now adjourned.
Thanks, Rodney, too, for sharing.
No, thank you guys. I appreciate it.
Thank you. Bye, everybody.
Bye, everybody. Be safe.
Thank you.
All right, great job.
Yeah, wear a mask. See ya.
Okay, it's just us. Rodney did a great
well,
job.
What do you think?
I thought Rodney really, was on target and did a great job. I mean, I miss Christian, but I thought he did well. Yeah, I made a lot of notes, man. Courtney's offered her assistance in trying to